Dr. Stan Lang, who is a medical doctor with over 30 years of experience in family medicine and 15 years in obstetrics. I just love Dr. Stan. He is such a brilliant, brilliant doctor. He has a huge heart, and he is very serious and passionate about helping his patients achieve optimal health and wellness through a holistic body, mind, and spirit approach. So today, Dr. Stan is going to share with us his experience and expertise on how to optimize your health and well-being while also reducing your stress to live a happier and healthier lifestyle naturally, holistically, and energetically. So he will also share with you how to incorporate the Nature's Frequencies products into that holistic approach and lifestyle. So what you can expect to learn from Dr. Stan today is going to be how and why to decrease chronic stress, very important, how and why to reduce discomfort and aches, how to address damage to the biome and what the biome is, the impact of insulin resistance on our health, the benefits of staying properly hydrated, the importance of a deep restorative sleep, and then the power of earthing and grounding. So I'm so excited to welcome Dr. Stan to our event today. Are you there, Dr. Stan? Are you there, Dr. Stan? If you will just unmute yourself.
Can you hear me?
I can hear you. Yay, yay. Dr. Stan, thank you so much for taking your time to be here today. I know you're probably off somewhere with your family in a somewhat remote area, but you're getting on the Wi-Fi anyway, so thank you
It's
so
called
much.
my home.
Oh! Well,
but it is remote and there's no Wi-Fi.
Yes, I was going to say all of our homes are becoming remote these days, but anyway, thank you for being here. And to get us started, just tell us, as a medical doctor, what made you decide to integrate a holistic mind, body, spirit approach into your medical practice? Because that's not, typical for most doctors today.
Yeah, I think first of all, my own perspective, I think, is because of my own spiritual perspectives that sort of leaned me in that direction, even as a medical student. But as a medical student, I was very interested in chronic stress, and even back in that long ago, chronic stress was a thing and was being studied, and I was fascinated by it. And ever since I started this study, that I realized that if I was going to maximally help people and myself with chronic stress, I needed to address all parts of the person, ideally at least. And so that means body, mind, and spirit, because they're all sources of chronic stress. So that's what started me on the path. Yeah,
well, I really appreciate that, because I am a believer too that we need to take in the whole person to address health, and not just be a one size fits all kind of approach. So what made you decide to integrate the Nature's Frequencies products into your practice?
Well, the reason that I started looking was the first reason was that I was looking for some non-chemical ways to deal with chronic pain, because of the shift in our country away from using medicines. And it was becoming very difficult for many patients to get relief from their discomfort. And seeing that was only I could see years ago that was just going to get worse. So I started looking for alternatives, and I sort of stumbled on Nature's Frequencies, and that started the process. That's why I started looking. I was looking for solutions for discomfort for patients that were not those solutions didn't exist in the medical world.
Yeah. And that could still provide, obviously, results without, undesirable side effects. So that makes good sense. So I know your holistic approach includes helping your patients decrease stress, especially chronic stress, and due to its debilitating effects on the mind, the body, the spirit, and, and just living your best life. And, we know that so many people today are experiencing really high levels of stress. So what can we do to alleviate stress?
Well, there's, like I mentioned, there are a lot of things in all parts of us, all parts of our being, physical, emotional, spiritual, that can do that. Obviously, we're going to narrow in on a couple things here today. I'd like to give kind of an analogy or a picture of what chronic stress is so that people can understand it better, if that's all right with you.
Sure, please.
So chronic stress can be looked at in a lot of different ways in the body, but if you look at the body's nervous system, there's two main systems that balance themselves continuously. And one is called the sympathetic system, and it's otherwise known as the fight or flight system. The parasympathetic is called rest and digest, as a kind of a simpler way to understand. And unfortunately, chronic stress pushes the balance like this. You're tilted way in the direction of fight or flight, which is great if you're trying to escape from a tiger, but it's not great if you've got a boss that you don't like and you have to see that boss every day, who's the tiger. And everybody has tigers in their life nowadays, or most people do, and they can't escape from it. And so that pushes the body into this chronic situation, meaning all the time. And that produces a whole host of chemical changes in the body that cause disease or make diseases worse. So the analogy that I'd like to share with you was several years ago, the main fireplace on the main chimney on our log cabin started to tilt. And after a while, it looked a little bit like the Leaning Tower of Pisa. And the problem, it was tilting over the house. So where it was going to go was real obvious. At some point, it was going to crash onto the house. And that tilt of the fireplace is a good example of what happens when those two parts of our body are out of balance. And most people that I see are tilted. They're tilted in a direction that's causing them to make themselves sick. And the solution for this fireplace tilt, we hired some people that literally patched the fireplace with more brick, and then they could anchor that back to the house. So the fireplace got straightened up again. So it's perfectly straight now, 20 years later. And that's what we're trying to do when we're trying to address chronic stress, is get balance back into the system. And that's what the products that Nature's Frequencies has, I think, mostly, I mean, it does that at multiple levels. But when I view what it does, that's what I'm trying to accomplish.
And thank you for, that's a great analogy. That's a great analogy. So are there some particular products that you want to illustrate now that you think, can help us get our chimney straight?
Well, chronic stress has so many different causes, as I mentioned, but the area that I'm most interested in is called the biome as a source of chronic stress. Is something that has become something I gradually changed to. But the biome is a word that refers to all the little microorganisms that live in your gut. And for most people, that balance is, there's a very delicate balance that's supposed to be there, but it is out of balance for most people. So you have 1,500 species of bacteria, over 5,000 species of fungi, and they're supposed to be in a particular balance, like that tilt or not tilt, and they're out of balance because of lots of different things that are happening to the biome, which are chemical effects, food effects, but also EMF effects. And so EMF damages the fungi in the biome, and it causes the fungi to put out a lot more toxins. They're called myotoxins. So the products that first attracted me to the company as I studied it more was a product called Emf Shield, which helps to prevent those energy signals from damaging the body. And the company has good research that shows that it actually does do this. And what it's doing is happening at a lot of different levels, but it's also happening in the gut. And so the gut is critical if you want to be healthy. And it's that EMF Shield is a major source of doing that. The other part of that foundational approach is a card that they have called an earthing card. And the combination of the two does a very good job of preventing that damage or helping to decrease the damage of all of this radiation that's coming into us from multiple sources, from largely man-made sources. And that to me is the major foundation of starting to fix our chronic stress problem. Now, a lot of people aren't aware of that, so I can work at different areas, but in my mind, I'm thinking this is really the end game, is getting the biome as healthy as possible.
So I have a question for you. I find that very interesting because, you know, so many of us and people today are so focused on, you know, just EMF radiation. We just want to be able to, you know, have something that's going to, you know, support us and protect us. So I don't think hardly anybody is thinking about what this is doing to their gut health. And we, you know, we normally think about, you know, how it's heating up the brain or, you know, different things like that causing inflammation. So what does this impact on the biome look like to you? I mean, how do you know that that's what's going on with somebody?
Well, there is some research
or do you just assume it, knowing what you know about EMF and the biome?
Yeah, it's very difficult to do biome research, but there's actually some being done. And there is published research that shows that EMF radiation to the bowel causes a shift in these species. Now, that might be boring to most people until they understand that increases their risk for cancer. When your biome is out of whack, your risk for cancer goes up. And why is that? Because 1/3 of the signals to our DNA come from the biome. These little signals are called microRNA, and all of these little bacteria and fungi are generating microRNA, which are absorbed by the body, which then signal the body to do different things, including turn genes on and off. And there are genes that are called tumor suppression genes that are in the off position for multiple cancers for people because their biome is out of whack. They're not getting the signal from the bacteria or the fungi that's supposed to be there. It's like it's missing in action. So there's published research that shows you can shift the biome just by this radiation. The second thing I already mentioned is that the fungi, 5,000 species, we're talking about trillions of fungi. Some of them produce toxins, they're called myotoxins, and under the influence of EMF, they produce hundreds of times more myotoxins, which the body wasn't designed to absorb. And the word toxin is in there for a reason. It's toxic. And, and so those are two things that we know of that EMF has an effect on.
So based on what you have just said, which is absolutely huge, I'm assuming that you feel strongly that a starting place for somebody is certainly with our EMF Shield on their devices and the earthing card.
I think those are foundational for everybody. You can definitely get benefits from any of the products. They're all standalone products. In my experience of the ones that I've tested, they're all standalone products, but I think they're all enhanced for the reason I just said. This is only one of the reasons why these first two products I think are foundational.
Yeah, and I know there's a lot more that can be discussed about, you know, EMF and 4G and all, and 5G and all that kind of stuff.
There's a whole lot there.
Okay, well, we will move on. I think that was very enlightening. I know I just learned something today. So let's go on to another important part of your holistic approach, which includes reducing the aches and pains, especially chronic discomfort that really takes a toll on the body, the mind, and the spirit. So let's talk a little bit about, you know, how you address that with your patients, because I know that has to affect the quality of somebody's life and then the way they feel about that quality of their life, right?
Right. The main reason I definitely want people to be comfortable. That's definitely a goal that doctors have of all stripes. And that's usually one of the main reasons that people come in. They're having physical discomfort or emotional discomfort. They don't normally sit at home and think about other stuff to come in and visit with. But when you're having discomfort, then you're kind of motivated to come in and see if there's something that can be done about it. So the main reason that I'm focused in on discomfort is because discomfort keeps people from moving. And if you don't move, you get sick. If you don't move, you lose your muscles. If you lose your muscles, you will get sick. And you'll have a lot more things that happen because you're not moving, because discomfort is keeping you locked in that chair or limiting how far you walk, and you're not doing effective exercise. So discomfort has two issues that I aim at when I'm looking at a patient. One is, can I relieve it just for the sake of giving comfort? But the end game is also, I'm hoping that that person is going to be moving more, because that's where the power of this strategy comes in the most. Is that I have a lot of patients that move a lot and they're in pain, but there's a lot of patients that won't. They hit that barrier and they stop moving. And I'd say the majority of people are like that in my experience.
Wow.
So
and then that just I mean, I guess if the less you move, the less you're able to move, right?
Yeah, it becomes a vicious cycle. It affects your joints. Your joint health drops dramatically because movement is like a pump to every joint. If your joint isn't moving, that pump isn't working. The joint fluid isn't replenishing itself. It's not cleaning out the joint. The muscles waste away. And if you have your muscles wasting away, your posture goes away, your ability to move goes away. And movement generates all sorts of chemistry and energy in the body.
Yeah. Yeah. So, and then toxins, right? Because if you're not moving and allowing your body to release toxins, does that just aggravate the whole situation?
Yes, definitely. There are parts of the body that especially are prone to accumulate toxins if they're not moving. That would be the legs. So people have swelling that starts to develop. But it happens all over the place if you're not moving, especially the toxins accumulate in the joints if they're not moving. They have to be moving to get normal joint fluid. The joint fluid doesn't become normal just by sitting there.
Yeah. So how do you address this with your patients, and what products of Nature's Frequencies do you think best address this?
So the first two that we already mentioned are, I think, helpful. But if I'm going to discreetly address the issue, the relief patch is very helpful. Putting it on or around the area of pain. What I've discovered for people that are having a lot of discomfort is that using more patches is important. If you under patch it, you may not get the results you're looking for. You can always go back and take off, not use as many patches, but using enough is critical, I think. And supplementing that with the CBD patch is, I think they complement each other as discrete strategies away from not counting the earthing card and the Emf Shield. They work well by themselves. And the headache patch also works discreetly in certain areas. So
Okay.
the first two are the main ones for pain.
Okay. Okay. And then
or discomfort.
Yes, we can use those interchangeably. So, and then with exercise, what are you recommending, to help people get moving?
Yeah, so I have several patients who have conditions that they just don't have energy to move. I mean, they're not having a lot of pain, but when they move, they just get exhausted. And when they get exhausted, then they stay exhausted for a long time. So they have this sort of very significant limit that's not a pain limit, it's an exhaustion limit. And I have a family member who, in particular, who has had a wonderful result to the nitric oxide patch because that provides a nitric oxide boost to the critical muscles that need it to keep going. And it's a really good example of how this particular nutrient, when it's out of balance because of probably chronic stress and other things, if you can get balance back, the body works better. There's energy to exercise again. So that would be the additional one in terms of pain or discomfort and lack of energy. I feel too tired to go out and move even. That patch helps people.
Okay, and let me ask you another question. Do you believe there's an association between this discomfort that people experience and low nitric oxide levels? in their body?
It is, there are definitely some correlations. It's not blanket, yes, but for some people, and it's hard to know because once you stop moving, you have more discomfort. So it's hard to know if it's a direct or indirect effect. I've studied it some. I wouldn't consider myself an expert on the subject.
Yeah, I just know that we've had some test strips over the years where we've tested a lot of people with their nitric oxide levels, and we have found that the majority of people, I mean, I'm talking in the 90% range, have low nitric oxide levels. I mean, so
Yes.
they are deficient in that, and then that brings, you know, another whole host of concerns cardiovascularly. Yeah.
There's a biochemical reason for that, and it's called insulin resistance.
Well, perfect. That's what I was going to ask you about next, because there are so many people who have insulin resistance, and many people don't even know that they have it. So how would someone know if they had it, and why is that so important for us to address that?
Well, you can definitely have severe insulin resistance and not be overweight. But if you're overweight, if you've got any increased abdominal girth, that's already a signal that you're probably insulin resistant. Now, there are some patients that I have that are overweight, and I've measured insulin levels, and they're fine, but the vast majority are not. And if it's coupled with blood pressure elevation, that's for sure you're going to be insulin resistant if somebody actually did the deep testing, which would be an insulin profile. But I don't really do an insulin profile on most patients because you can deduce that from another test, which is called a lipid profile, and the ratio of triglycerides to HDL, to good cholesterol, it should be 1 ideally. Anything above 1, you're trending towards insulin resistance, and most people are well above that. Lots of people are 10 or 20 even, that is the evidence of it. The issue is that the body's insulin isn't working. And so it's not working well for the reasons of mainly that our dietary choices that have accumulated for decades. And as insulin goes up, it becomes a pro-inflammatory molecule. Then it signals the body to start holding on to fat. So you have a fat storage signal, and then it signals the body to raise blood pressure. And so it's part of a spectrum disorder that hypertension, otherwise known as high blood pressure, cardiovascular disease, otherwise known as coronary artery disease, and strokes are all connected to this insulin resistance spectrum, ultimately ending in diabetes, which is epidemic. Now, everybody that I know of would like to avoid a stroke and a heart attack. So it's a good reason to fix your insulin resistance, and most people want to do it with a pill, and a pill won't fix it. It'll only fix the evidence. So it's like going to the scene of a crime and erasing the evidence, but the crime is still going on. So the medicines that we have don't fix insulin resistance. It must be done by lifestyle.
So, and then insulin resistance is basically where your body has gotten to a place where it needs more and more more and more insulin to balance so let's just say you have a fire, it takes more and more water to put out the fire, and the more water, the more inflammation. Is that
yeah,
right?
So the discrete thing that insulin is aiming at is monitoring the blood sugar. The body desires balance in everything. There are set ranges that it works really hard to maintain these ranges in spite of what we do to it. It still works hard. So when the blood sugar goes up high, insulin goes up high. And after a while, if you keep pushing that blood sugar from eating high glycemic foods a lot, then the body becomes insensitive to that insulin signal because it's outside of the physiologic range. So the body has to pump out more insulin to get the same amount of work done. And eventually it goes up so high that these other pathological changes happen. And the good news is it's all fixable easily without medication if a person will do the lifestyle. And the lifestyle is how you eat and exercise. And if you don't do both, you're much less likely to reverse it.
Okay, so let's talk a little bit about, because this is a holistic approach, let's talk a little bit about what you eat, exercise, and which products you would recommend to help with this.
Well, what you eat it's more like what you don't eat. So you try to avoid all refined carbohydrates, or at least most of them. I'm saying if you're trying to reverse it. You know, somebody that's healthy and they don't have a trace of a condition, they have a lot more flexibility in what they do. But somebody that is not in that state, which is most people in our country, if you want to fix it, you've got to really turn back on the high glycemic carbs, which are grains, potatoes, rice, and sugar. So that wipes off the plate of a lot of things that people eat a lot of. But if you want to fix it, those are the food. You got to pull out the signal, or the body, if you keep giving the body the same signal, it keeps doing the same thing. And so shifting so that most of your carbs are coming from fruits and vegetables will help that dramatically. Then you still have protein and fat as your source of food. So that's from a dietary perspective. We've already talked about exercise. Exercise is the most powerful signal to, at the cell level, reverse the insulin resistance. So it sends a signal to the little receptors that are saying, I'm not going to listen to you. They start to pay attention to the insulin signal. The third thing is getting back to stress reduction. You can go into insulin resistance and being perfectly weight, and even eating perfectly. If you're under enough stress, your brain says, we've got stress, and so it tells the muscles they're in insulin resistance anyway. So the body goes into insulin resistance because of chronic stress, and that can be mitigated through the things we've been talking about here.
Wow, I am really deciding I am not going to let myself get stressed. I'll let you know how I do with that. Okay, this is really impactful and empowering. You know, I think you have information, knowledge is, you know, the beginning of change if people feel like that's what they want to do. Let's move on to another subject. I know that you're one of the very few medical doctors that recommends the practice that's known as earthing or grounding. But I can see why it would be the perfect, you know, mind spirit practice to incorporate into a holistic lifestyle. What can you share with us about the importance of earthing?
Well, earthing is, prior to stumbling across nature's frequencies technology, earthing was the only way that I knew of that you could do something about the EMF issues that we've been talking about, because it counteracts the signal inside the body. This has been measured. You can do voltmeters on the body and expose yourself to your laptop or to your light that's generating EMF. And once you connect with the earth, the voltage drops dramatically. So earthing is a very powerful way to decrease the effect of EMF on the body again. So it's kind of back to the first thing I was talking about. But it was the only strategy that I had. And a lot of people have trouble standing on the ground in December,
Yes.
barefoot.
Yeah.
There are technologies that allow you to still connect with the earth in December, and I heartily recommend them. I think the more you earth, the better, because we are literally, you know, being bombarded. Most people have smart meters in their house, which put out huge amounts of radiation from their electrical system, way more than the old analog meters. So there's lots of different sources that people are completely unaware that their body's being assaulted. I won't say damaged. It depends on how resistant their body is, and you're all different out there. But it's being assaulted by this radiation, and you just can't feel it. But you will feel it eventually.
Yeah, and you can't see it either.
Can't see it, and so people think that they've never heard about this before. They think, oh, that's just crazy. And the first time I heard about it, I thought it was interesting. I have a more open mind than a lot of people, so I don't normally think crazy when somebody's doing something, unless they're killing themselves. But it does sound strange because we have been literally insulated from the earth since our shoes changed from leather soles to these man-made substances, and since then we have not earthed naturally. Leather conducts the earth's energy to us, but these other shoes don't. So we're literally insulated from the earth at all levels of our life. Most people don't touch the earth's energy the whole day. And it's sad, but it leads to this chimney tilting. It pushes them into a chronic stress imbalance. It's a signal for that fight or flight system to go into overdrive because the body senses there's something going on, and it's going to respond with the fight or flight system. But it was designed to be temporary bursts, never designed to be chronic and continuous. And so earthing is one way to kind of push back against that. It's very simple to do. I do it every lunch when I can. I walk in the park barefoot, you know, and it's simple. It's cheap. The earth is cheap.
And natural, and very, very natural.
Yeah.
But it is nice to have those benefits.
Yeah, most people notice this. Yeah, most people notice this when they go to the beach. They feel great. Well, it's because they're massively earthing.
Mm-hmm. Mm-hmm. Yeah, we're all drawn to that for a reason.
Yep.
So I think our bodies intuitively know that. So I am very grateful to our founders for developing this this technology that allows people, you know, to be grounded basically 24/7.
Mm-hmm.
And we all keep our cards with us, and we sleep with them. And I know I don't go anywhere without mine. So you've talked to us about the products and some of, you know, the ways that you like to use the products. Let's shift gears a little bit and talk about a deep restorative sleep, because we know that that is absolutely critical, you know, to achieving and maintaining optimal health. And I know that there's so much going on in the body when we sleep. There's so many people who don't get the quality or quantity of sleep that they need. So can you share with us, you know, why it's so important to get that deep, restful sleep?
Yeah, so insomnia or difficulty sleeping for a lot of different, there's a lot of different ways that pattern is interrupted, but it's one of the most common reasons that doctors are consulted because people increasingly can't sleep well. And the role of sleep is not just to take a break from the day, but it's actually designed so that your body can restore can fix the brain, but also to fix the body. The body's ability to fix itself is totally dependent on getting what we call restorative sleep, which means that the brain goes through these different wavelength changes cyclically through the night. And as it does that, it goes to a certain stage that then it starts aiming on a certain body part, and it makes that body part basically become paralyzed for a little bit of time, and it works on it and it fixes it. Then it moves on to the next body part and the next body part and the next body part. And all that's supposed to happen every night when we sleep. Well, if you're not getting restorative sleep, that's not happening. And people wake up feeling achy, tired, and foggy because the brain didn't get to fix itself either. So it's not firing on all cylinders when you get up and you need several cups of coffee to get going. All of this is a consequence of not having restorative sleep. And then duration of sleep, of course, is part of that. So you could have restorative type sleep, but if you cut it short at 4 hours, then you're not going to have the full benefit. So restorative sleep is critical for the body to fix itself. The fix itself systems turn on when we go to sleep.
Yeah, I know I've been using our sleep product, and I just use one patch on my left temple, and I just sleep so well. I mean, I just have a great sleep, and I wake up in the morning and just, I'm ready to go. I mean, I don't have to have my coffee, but I enjoy my coffee. Anything you want to share with us on that?
Yeah, that's probably the area that I've had the most seen the most impressive things, and especially in my own body, because I've had chronic insomnia for years because of a major back injury that I had more than 10 years ago. I herniated 4 discs the same time, was in chronic pain for a long time, and that has an effect on sleep. So you get into the habit of bad sleep, and I've needed to rely on multiple different herbs to help me sleep, which I could. But what this patch has allowed me to do is I'm using a fraction of what I was using before and sleeping better. So I consider it a very effective strategy. So I find it very effective.
Yeah. And I really feel like the quality of the sleep that you have, it really sets the tone for the day. So since I know that's especially for myself, I mean, sleep is at the top of my priority. Anybody who knows me knows that, because I know that they know that I like to get a lot done. I like to live life. And if I haven't had a good sleep, then that just, it's just not possible. So,
So if you don't,
yeah,
I'd like to kind of tie back to what we were starting at the beginning, which
yeah,
is that one of the major reasons that people don't sleep is because of the things we talked about at the beginning. Their biome's out of whack and they're being assaulted by EMF. So the EMF mitigation or EMF shielding effect that is part of this technology, I think, is one of its most powerful downstream effects is that people sleep better. And it's because of these other things we've already talked about. That's one of the reasons why people are sleeping better. And that's why I think doing it all is better. Using the sleep patch by itself is good.
right, right. And a lot of people, they don't realize the impact that the EMF is having on their sleep. And, I guess it could just be one of those little cyclical things. I don't sleep, so I have to take something, and the EMF just keeps flowing. So, yeah, I think we have got really, we call our products lifestyle essentials, and it's really because it's going to make a difference in the type of lifestyle and the quality, of life that you have. Is there anything more you want to say about sleep? That was a pretty powerful testimonial you just gave. Yeah.
That
Okay.
covers it pretty well.
Okay. Well, just a couple of more things. We always hear that hydration is critical to achieving and maintaining optimal health. So share with us from your perspective why it's so important for us to stay hydrated, and what's the best way to do that, do you think?
Yeah, so most people, as they get older, get a little dry. I see that in blood tests that I do that measure kidney function, and it looks like the person actually has some kidney failure. But if you just tell them, start drinking 60 ounces of fluid for a week and you retest it, the tests come back normal most of the time. And the person didn't feel bad. They didn't know that they were a little dry. But literally, we got biochemical changes that you can measure that the person's a little bit dry. And now why that's important for these technologies in particular, it's important for lots of things. Like I just mentioned, the kidneys work better. But it's important for this technology because the signal that's coming from the patch is passing through a water barrier. And so the signal is transmitted into the body more effectively. So that's the main reason that I would suggest it.
Well, thank you. That was a great way to say that. And do you drink water that has passed over your earthing card?
No, I know
Okay.
most of y'all do, but I
Yeah.
have well water.
Oh, you have well water. Okay.
Yeah,
Well,
so
we do.
it's
Yeah.
already earthed.
Yeah. Well, we those of us who don't have that, we use the earthing card water, and I think it makes a lot of difference. So I guess one last thing would be to see if you have a favorite patient story that's using the products that you'd like to share with us.
Yeah, I would like to share a story that that is relatively recent, and this is somebody that I've known for more than 20 years, and so I know his issues very well. I have to see him very frequently for those issues, and he has a mechanical problem that he was born with that produces a great deal of discomfort. He's had so many procedures to try to deal with this, and when I saw him recently, he just had a significant surgical procedure, had a temporary time of feeling better, but then he was a lot more uncomfortable. And this is in spite of taking a lot of pain medicine. So he was taking what would be considered a huge dose already by most people's standards. It's been followed also by a pain management doctor, but that didn't help him. And so I offered him 5 different alternatives at that point, one of which was these patches, and that's the one he chose. So I used the relief patch and the CBD patch on some areas on his back. And he sat there for a few minutes and noticed that he was feeling better. After about 30 minutes, he left. And I talked to him the next day. And what he said was that when he got out to the car, he had this profound relaxation come over him. and he fell asleep while he wasn't driving, his wife was driving. He fell asleep, and he sort of stayed dozing while his wife did some shopping. He went home, and he felt this profound drowsiness. Was also noticing that his pain, that is just the back pain, was decreasing. Went upstairs and took a nap. He never sleeps in the afternoon. He said, I've never taken a nap in the afternoon. Took a 2-hour nap, and he said that it was the most restorative sleep that he's ever had. Those were the words he used, restorative. I didn't prompt him for the word. And his discomfort was dramatically less at the same time. Now, understand he's been already on this medicine, so I'm not saying these patches did all that, but he was experiencing a lot of stuff that wasn't being controlled. And he, 3 days later, he was still having that same degree of relief. But he also experienced a profound improvement in the sense that his mind was stressed. He's always under stress because of the pain. And he felt peaceful, which was, again, his word. And I thought it was really interesting that he had this shift not only in the discomfort, but he slept much better. And then he had this sense of peace that, that came over him. And I thought it was a fascinating example of how shifting literally the patch on the chimney made him come into balance.
Wow. What a great story. And that must have put such a big smile on your face.
Yeah, it did. When somebody experiences relief that they have been denied for a long time, it's always a happy moment.
Yeah. And that's really why so many of us are here today. And I know that, that's why you're here, Dr. Stan, too, is because we truly like making a difference in people's lives. So I want to thank you so much for sharing that story, and certainly appreciate your valuable time. And I know you have a very busy schedule, and thank you for sharing your knowledge and your expertise with us. We appreciate it so much. And
You're welcome.
we look forward to hearing from you again. Thank you, Dr. Stan.